Hello.
Hello, how are you?
Okay, there may be some banging in the background. They're replacing our roof today.
Oh, wow, okay.
They're going to try to cover it before the storm tomorrow.
That's good to have a solid roof before the storm.
Well, it's going to be with tarps on it.
Oh,
Until they don't want to put the shingles on until the end of the week, yes. Hi, Susan.
Are you cold, Dr. Marvel?
Well, yeah, it's those blood thinners I take. It's embarrassing sometimes.
Hi, Dr. Marvel. Hi, Susan. How are you?
Good.
I'm good. How about you?
Hi, Dave.
I think I've been Susan, I think I've been providing you some target practice on Pilot Town Road.
Good.
I think I stepped out one morning and you were coming up the road.
Oh, well.
That's okay. We didn't manage to collide.
No, we did not.
Is all that hammering going on at your house, Dr. Marvel?
Yeah, they're replacing the roof.
Oh, are they? Okay.
They're taking off shingles today and putting tarp up for tomorrow.
I was going to say, this is the wrong day. Tomorrow's going to be a bad day to be without a roof.
Yeah, they don't plan to be working tomorrow.
I guess not. You're going to have a blue tarp tomorrow.
Yeah.
You will be cold tomorrow. I have your peanuts done, Dr. Marble.
Oh, thank you.
I'll be dropping them by one day, putting them in your car.
Well, our
How are you?
got crowded with dump trucks and so forth now, but
Yes. And tomorrow's not going to be a good day to deliver anything. Raincoats.
Yeah.
Hi, everybody.
Hi, Paul.
Hi.
Hello, Dr. Tam. How are you today?
I'm fine, Mr. Mayor. How are you, sir?
Congratulations on your new appointment that I read about in this morning's Cape Gazette.
Thank you very much.
That's
I
quite an
haven't
honor.
seen it yet.
David, have you changed clothes since the last time I saw you? I feel like I've been on video conference with you all day and you look different now.
Dr. Cowan, when you start doing this job, you notice that Lynn is also responsible for makeup and costumes.
That conference room has turned into a wardrobe, I guess. So you could just go in and slip into another outfit, huh?
Yeah, I think we're painting it green, Mr. Mayor,
Oh, yeah. Okay.
like Johnny Carson.
Yeah, exactly.
So Ted, are we waiting for anybody else? Do we know if Nancy's?
Probably Nancy Powell usually joins us. I don't know if she's going to, Anne Marie.
I don't think Cheryl will be here today. Her mother-in-law passed away from COVID.
Oh, sorry to hear that.
Oh, my gosh.
Wow.
Hi.
Well, that's terrible. Okay. then I think we're all here, so we could go ahead and get started.
Okay, well, thank
We
you,
have
everyone.
8 members of the public that are on. So, great,
Okay,
thank you.
so there are minutes from the last meeting.
Mhm.
If you've had a chance to review those, if we could get a motion to approve those.
So move.
Is there a second? Or a second, is there any discussion? All in favor?
Aye.
Aye.
Any opposed? Okay. So I guess the mayor and I had a brief email exchange a little while ago, and the hot topic obviously is vaccine and where is it in our community. Just before we get started with that, COVID in the community is widespread and rampant right now. Unfortunately, in the state, the number of hospitalizations has eclipsed the numbers that we saw in the spring, which is unfortunate. The good news is in Sussex County right now, our hospitalizations have not peaked compared to our numbers from the spring. But there's no reason, unfortunately, not to suggest that that's going to happen to us anytime soon. It's not uncommon when we see other respiratory infections for Newcastle County to get harder first. So we'll cross our fingers and prepare for it, and hopefully it won't happen. So, and as we all know, the death total within the country now has eclipsed 300,000, which is too bad, staggering, tragic. I think one of the things that I think about it as we're talking about the vaccine now and other pivot points in our U.S. history. So we lost 2,977 people on 9/11. And we're losing numbers similar to that every single day now to COVID. So although there's light at the end of the tunnel, it's still kind of dark. It's that saying, David, you mentioned before, but it's always darkest just before the dawn. So with that, to move to some good news, the Pfizer product is in the state. As you saw in the news yesterday, product was delivered from the state to Bay Health, Kent yesterday. We anticipate getting our shipment of Pfizer vaccine from the state anytime now, anytime being any hour now into tomorrow. Our plans are to begin to immunize our employees beginning Thursday. We'll have a very limited number relative to our number of employees. I think our initial shipment is somewhere in the neighborhood of about 600. For the initial shipment, we have just over 3,000 team members. We anticipate that as every week goes by, we'll be getting more, hope to get more vaccine. So it'll be a kind of a Herculean task to get everybody vaccinated. And remember that to get vaccinated twice. So everybody who gets initial shot will need, with the Pfizer product, they need to get a second shot within 28 days. So for people that end up with a Moderna shot, which will be, at this point, the state has allocated the initial doses of Moderna when it's approved to local EMS agencies. Although, to point out that's not been approved yet, hopefully by the end of this business week, the FDA will approve it. Those, again, are two-shot series separated by 21 days. So, Dr. Tam, do you have anything else that you want to add with regards to where we are at the organization?
No, I think, Dr. Cowan, you covered pretty much all of it. I just want to reassure the community that we continue to have capacity here for taking care of all of our patients, both COVID as well as non-COVID. That we continue to be in communication with the governor's office as well as other health systems. And I think it's important to note that certainly when you look at the entire state, as Dr. Cowan said, certainly Newcastle County and Kent have been hit hard with COVID-19 inpatients. Both health systems in Newcastle as well as Kent actually have surpassed the number of COVID inpatients from their spring peak. BB has not. BB remains below, and so we continue to be, as you heard me say, hope for the best, plan for the worst. We have not restricted any procedures or any cases at this point. That's something that is being done to some extent both up in Newcastle as well as Kent counties because of their capacity issue. But we are monitoring that on a daily basis and working with our team to ensure that we improve our work processes so that patients come in if they are needed and that they are discharged as soon as possible to ensure that there is adequate capacity to meet all the healthcare needs of the community.
Good.
Paul, a quick question. I saw on one of the national broadcasts this morning, they were where one of the hospitals, I believe in New York, was giving a patient a card telling them when they should come back for their second dose. Is that part of the plan here in Delaware?
So I can only speak for BB because I think everybody who's going to deliver vaccine is going to have somewhat of a different plan, although everyone will be uploaded into the state database. But for instance, at BB, when you are given your appointment for your first vaccination, you'll be given a follow-up appointment also.
Okay.
So anticipate that happening. The same process, I'm also involved with the immunization plans for the Sussex County Paramedics, and they have a similar plan.
Okay.
So,
and how will a person living here who does not have a primary care physician in Delaware or in Sussex County get into the system?
well, timing is the first thing. So the vaccine being available for right now, it's available just for frontline healthcare workers, and it probably will not be available for the general public, depending on who you listen to, sometime into the springtime.
Right.
And the question is whether or not people that do vaccinations now, whether CVS and Walgreens, whether they will invest in the infrastructure to do that, or whether it'll be left to the local healthcare organizations. We certainly, if we have vaccine, we being BB have vaccine, we will provide it to really everybody that we can. So
I've had a couple of questions from people who have recently moved here, haven't established a relationship yet, and yet they're in what would be considered a higher risk zone.
yeah,
They're curious, do they need to go back to where they came from, where their primary care physician is, to get into the system? I've heard Walgreens mentioned on national television, of course, as a possible site, and that changes everything. But I just didn't know.
I think it's going to come down to whether the typical vaccinators, and those being pharmacies and healthcare, whether they can get the product. And then, again, the challenge is at least the first two products, the Pfizer product and the Moderna product, they require some specialized refrigeration.
Sure.
The Moderna product is a little less stringent, but fortunately we'll have some time to figure that out. And I suspect it'll look a little different what we do, because we're going to learn from vaccinating all the healthcare workers.
Right.
But it's going to be a Herculean task. There's no doubt about it.
Yeah, I think one of the things that you mentioned 300,000, which is a staggering number. If you think about it in terms of the state of Delaware, it's a third of the population.
Right.
So, Mr. Mayor and Dr. Cowan, if I could just amplify, only because I learned a little bit of something this morning. Number one, there is a national database that's being created, or that is created. It's called Tiberius, under the Operation Warp Speed project that they're populating right now. Now, that's fed by every individual state, and of course, for us, the state's vaccination program is called DelVax, I understand. And so, what Dr. Cowan is saying is absolutely right. That they're in the process right now of developing the plan for what they call phase 2 or phase 3, and the timing of that is probably, as he says, spring, in terms of everybody else. And so I also know that DPH, Division of Public Health, is putting together a vaccination call center so that people who have questions may be able to ask questions about where they might be in terms of their, where they stand in terms of the prioritization. It's kind of like what, and we will probably be doing the same thing at BB. If you recall, when we had set up the call center and also the app, you know, it's based upon certain questions that are asked, and that gives you the answer of whether or not you should get the test. And we envision the same kind of thing where once these criteria are more firmly established, we'll at least be able to set up a system where we'll be able to assign people, or at least identify for them, that phase. Are you phase 1, phase 1A, phase 2, phase 3? And I think that will be important for when people are, you know, on the news or in communication are told, okay, now we're starting to vaccinate phase 2 or phase 3. So all those who are in that phase, please make sure and go to your doctor or go to Walgreens or something like that.
Great.
So BB will make sure that we put out that information on an ongoing basis through our Facebook pages and our Facebook Live events.
Perfect. Thank you.
We've had a number of contacts of people who are interested in volunteering, however, if they're needed. In particular, and Mert Foos from the American Legion, who I'm sure you know, Dr. Tam, because she's our lead ambassador and Christmas elf. The Legion has volunteered that if we need a large outdoor facility, they have a large pavilion that could be used for some sort of a community vaccination event. Mert is a retired nurse. She maintains her nursing license here in Delaware. She's interested. So, and then there are other people without the medical background if you need help with logistics and things. So whether it's BB or DPH, I know there are people in the community that are very interested in volunteering to help in whatever way they can.
Well, that's good. We certainly appreciate that. And like I said, I think the landscape will be different once we get to phase 2 and phase 3.
Notice that Mert's on the call today, so she's
Great.
paying very close attention.
Well, great. Well, thank you, Mert, for extending that invitation. We very likely will take you up on that at some point. We have a way of doing that when people offer us stuff. I think the other sort of teaching point with the vaccine that we are reviewing with our team members right now, which is helpful, is that even though once you're vaccinated, and certainly we don't know what degree of protection you have after the first dose. That data has not been released by Pfizer or Moderna. Certainly you need to know the 2 doses, but more importantly, even after that, we'll still be asking all of our team members to still, wear a mask, wash their hands, and stay 6 feet away. One of the critical questions that we don't know from the study so far with these vaccines is we know that it prevents COVID, demonstration of COVID infection. You don't get sick, essentially. What we don't know for sure is, could you be an asymptomatic carrier? I think we'll know that. We'll probably know that by the spring because we'll continue to collect data, we being the FDA. But at that point, this information is still kind of unknown. So in as much as everyone is excited to get a vaccine, it's still, from a public health standpoint, it'll be critical to wash your hands, wear your mask, and keep your distance, without a doubt. Were there anybody have any other questions about anything?
I don't see anything in the chat at this point, so I think we're good. Thank you.
Okay.
Yes, Dr. Tam, do we have the monoclonal antibody here at BB?
Yes, Dr. Marvel, we do. We've been giving the monoclonal antibodies, and we have more scheduled to give to patients. We have our infusion center standing by to do that, as well as actually, as Dr. Cowan can probably amplify better than me, even a location in our emergency room if people need that monoclonal antibody infusion.
Yeah. So just a quick comment on the monoclonal antibody. It's not a panacea. There are specific requirements, who can get it, who can't get it. So it's another tool in the tool bag, but it's certainly not a big player in the treatment of the disease right now. So, but we'll take any tool we can get. There any other questions? Okay.
Me.
Good.
I think we've seen the governor obviously extend the order and obviously asking everyone to stay at home and through the 11th of January, which is the next extension of the emergency status that he can do. And I can't see that. I don't foresee that changing anytime soon. Obviously, the holidays are going to create a very awkward situation for a lot of people.
True. Certainly, the presence of the vaccine in the state should not materially change the degree of infection we see in early January. I agree with that, fortunately. But there is hope. There's definitely hope.
Okay. You had a fantastic success with your flu vaccination this year. Have you seen much of a results of? Are you seeing many cases of flu showing up yet?
We have not seen much flu in the state yet.
Great.
Yeah, it's interesting. It'll be, and you know, in retrospect, it'll be interesting to see if we don't see much flu because the flu vaccine was really effective this year. If we didn't see much flu vaccine because in addition to flu vaccine, people are wearing masks and staying away from each other,
Yeah,
which,
exactly.
which is perfect advice for the influenza virus also.
Sure.
But
Okay. All right. In terms of us as a city government, we continue to have our mask requirements downtown, and we continue to, most everyone's working from home at City Hall, and we are encouraging people not to gather. And our Santa is even not allowing anybody in his house this year. And thanks again to Mert and the hospitality ambassadors. We've got a very safe program, I think, going there. Are there any other recommendations that either you or Dr. Tam would have in terms of things the city should be doing other than what we're currently doing?
I do not. David, do you?
Mr. Mayor, I think that you're doing everything right. And you know, just as a personal observation, now that I'm actually able to spend a few hours on a weekend walking around, I think all the retailers are doing a fantastic job downtown as well as other parts of Lewis, and greatly appreciate their support. And I think the only other thing I would say, of course, in our public venue is that, you know, BB Healthcare remains open. And so one of the things we want people to do is go to the emergency room if they are concerned about a medical problem, or go see their doctors, you know, in the clinics because it's safe. Go to walk-in because it's safe. Because the last thing we want are for people to just hold off and get sick to the point where they require hospitalization. You know, it's not just COVID that impacts the hospitals and the health system, but also people who have strokes or heart attacks or other medical pneumonias that could have been potentially averted, you know, on an outpatient setting as long as people took care of themselves. So if I could just take an opportunity in this public setting to ask people to make sure that they go see their doctor when they have a symptom, make sure they take their medications, get their prescriptions, because that's how we're all going to get through the season together.
Great. Thank you. Okay.
Good. I think the last order of business is to look for a date for the next meeting.
Yeah. Looking up, I think right after the holiday maybe would be a good idea. What does that first week of the 4th through the 8th look like for you, Dr. Cowan? Or Dr.
So that week looks okay for me. Dr. Tan, what's your schedule like?
I think it looks fine, although once again, it will be up to Lynn to tell me where to go, what to wear.
Can
It'll be fine, sir.
Can you ask Lynn if 3 o'clock on the 5th is okay?
Yep. 3 o'clock on the 5th is fine. She's got it blocked off already.
That was amazingly easy. That's great.
Good.
Okay. All right.
Okay, everybody have a Merry Christmas.
All right.
Wonderful
Thank you.
holiday. Thank you very much. Appreciate
Sure.
all the information. Thank you.
See you.
Bye.
Have a good holiday.